I would like to introduce to our audience Adam Habig, president and co-founder of Freedom Healthworks. How are you doing today?
Very well, Aaron. Thank you. And thank you, Brittany.
Of course. Are you well rested today?
More so than you, yes. Thank you.
We could really have some fun and just like throw out some random concepts and words that have no connection to what we're talking about, just to make sure that she's dialed in there. Right?
I just hear clicking right now.
This is not good, Britt. This is not good. Oh, Adam, thanks for joining us. Don't mind the oddity that's over here. You're here to tell us about Freedom Healthworks. That's an Indianapolis-based company fueling the rise of direct primary care. Before we get into the specifics of what that is, can you remind us what direct primary care is all about?
Absolutely. And it's a bit of a mundane term for something that we think is really, really exciting. But to unpack that, there are two types of healthcare that we experience, most of us in our lives: primary care versus specialty care. Primary care is your family medicine, internal medicine, the docs you see on a regular basis. And really, stats show the only doc that 90% of us need to see in a given year, right? Then you have the specialists, your surgeons, your different kinds of more episodic treatments that you see cardiologists. So when you unpack the word direct primary care, we're talking about the primary care docs, the frontline physicians that we know and use the most as consumers. And when we say direct, we are pioneering, and it's been a concept that's been around for about a decade now, but we are pioneering the large-scale expansion and growth of the idea that you no longer need to work through the traditional barriers and the layers that get in the way within the healthcare system as they've evolved over the years. This is direct relationship with a physician where you both are unlimited, essentially, in your contact and your access to that physician. You pay that physician directly, so there are no more intermediaries that get in the way. And it really has a threefold effect. And these are the three items that pundits have said are impossible in the American healthcare system. They said it cannot be high quality, widely accessible, and affordable. And we say, yes, it can, and it's called direct primary care.
So it's a beautiful thing, and especially for everyone that has just gone through the change of insurance in November. And we understand that on the healthcare.gov network, there's been a huge amount of price increase collectively across the board for the insurance carriers, right?
Absolutely.
So it's been a tough thing, and families are trying to find alternative ways to be able to take care of their family. Right?
Yeah.
But on top of that, avoid the bureaucracy that just seems to be getting in the way of how we need to live.
Yeah, absolutely right.
What are you doing to remove that barrier and making it more cost effective for those of us who need to see a primary care physician?
Possibly today.
And we all do.
And can you get me in this afternoon?
If you were seeing one of our physicians, they'd say, yes, we can.
Okay.
And you'd be over there in an hour, right? So what we do, there really isn't... It's sad because health insurance is no longer equated to health care. That's a mind shift, right, within the populace. We have to get over that hump. So today, even though we have expanded health insurance coverage throughout the country, we still have stats that say every year up to a quarter of Americans with insurance will refuse or skip necessary medical treatment. This is care they need to get, and they're skipping it. Why? They have insurance, because it does not equate to health care. Insurance no longer guarantees that minimum level of health care when you need it, right?
Insurance is not insurance anymore. In all frankness, it's what they're willing to pay.
It's robbery.
That's very true. Well, I won't touch that one, but
I go there.
This does allow. So you asked, and to answer your question then, if you can remove the frontline physician care from the aegis of insurance and let insurance go back to what it used to be, what it looks like for our auto insurance, our homes, right? It's there to safeguard against a catastrophic, really expensive episode, right? It's not there to really to change your oil or to fill up your gas tank in terms of auto insurance. That's what direct primary care allows insurance to do. So when we look at the landscape and we say, yeah, families are facing these tremendous rate hikes year after year after year. Why? How can we do something about that? And I know we're going to touch on this, but last year testified in front of the General Assembly here, and one of the questions was, what are we going to do about healthcare prices? And I said, health insurance. They asked health insurance prices; those cannot come down until healthcare prices come down. What direct primary care does, it lets healthcare prices, the price of medical goods and services, fall to their natural level. which if you've been in a hospital and you've paid $300 for an aspirin or
Right.
50 for a bandage, you know that the inflation is tremendous. So again, a little off point, but my point is that when it comes to health insurance and health care, they're interlocked. Direct primary care carves out the primary care piece of that so that insurance can go back to being insurance and the price of those premiums can come down while you still get better care at the primary care level, but you buy it directly from the physician.
It's a bit of a self-writing environment that you're talking about, is that insurance took care of everything, therefore all the costs have just increased exponentially. So what you're introducing into the ecosystem is kind of a reset of what we used to pay for out of pocket to our local physician, and allowing healthcare to do what it was supposed to do to begin with.
You're
right?
exactly right, Aaron, with a twist. And with a twist that says someone's called it an historic innovation because it harkens back to the days when you would go in and believe me, there are still physicians practicing today that remember folks that would come in and they would pay if they could. If they couldn't pay, I mean, talk about trading a basket of
bring you
eggs
a
or
chicken.
a pie.
Absolutely.
That's not too far in our rear view. Our doctors that are with us now have the ability to do that again, to perform charity care
There
that
it
they
is.
may not otherwise be able to do.
They're completely shackled
community.
inside the existing insurance schema that has been foisted on us.
I mean, you ask a
they
physician-
can't move the needle.
You're right, Aaron. You ask them, try to deviate from the Medicare price sheet and see what happens.
Oh, no, absolutely. So Freedom Healthworks actually was created by children of doctors who had some very astute observations about their own parents. Can you actually tell us a little bit about the background of Freedom?
Absolutely. So my parents, both primary care docs here in Indianapolis area, practicing for 30 plus years. They are some of that cohort that can remember accepting a load of firewood or a cherry pie in payment or chicken, right?
2 chickens.
2 chickens. The price has gone up. But they...
Oh, yeah. It's on.
They're some of the most seasoned, experienced physicians, skilled doctors that we have in this country. And they're the ones also, and they're emblematic of what their generation is facing, that are looking for the exits early. They're burned out. They're done. It's not just the docs in that cohort, though. It's also docs that are my age and even younger that have said, this is not what I signed up to do.
Absolutely.
And no one wants to really feel sympathy for physicians. I get that. But at the same time, the practice of medicine today looks vastly different than it did 30 years ago. And a lot of the physicians that signed up for when they went through med school, and you go through that amount of sacrifice and expense, and you come out of med school waiting to serve patients. You're craving finally the payback, right? I get to go serve patients, and you serve insurance companies, you serve hospitals. That's not what they signed up to do. What this model does, and why we built this, is because we saw this in our own parents, and it mentioned I co-founded this with my brother and my sister, and so it's a bit of a personal journey for us as well. But we saw them looking at early retirement. And why? They still had the fire in their belly to treat patients, to save lives. Their response was, I cannot deal with the paper shuffling. I cannot deal with the hamster wheel that's forced upon me in terms of seeing more and more patients every year. Reimbursements are stagnant. Costs are rising. I'm running myself ragged, and for what?
Gosh, that just speaks volumes.
Yeah.
That they have that passion to care for people, but then they're just getting burnt out on both ends of the candle, and they just can't do it anymore.
They were, and look at their patient base, and this is really, I think it says a lot. They've got a lot of folks who need extra attention. Got a lot of older folks, a lot of Medicare folks. You're not going to see them and practice good medicine in 7.5 minutes or 12 minutes, whatever the national average visit is these days. So we looked at this, and my background is in finance, and I'm an attorney. And I had a couple other businesses that were successful, and I was just leaving one of those and looked at their situation and said, why can't we find a solution that works for you, that cuts out the part of the business of medicine that you don't enjoy, that's really driving you nuts, and get back to just practicing medicine? And they were the inspiration. They had, I don't know how many times I sat through a dinner and they're pounding the table saying, one of these days I'm just going to tell the insurance company, I'm going to tell Medicare, I'm done with it. I'm going to hang a shingle. My patients will pay lower prices. They'll be happier with me. I'll get to practice better medicine. And we said, why don't you? What's holding you back? And they didn't realize that this option, which is really something that was around 30, 40 years ago, is still viable. And I mentioned earlier, Aaron, that this is that model with a twist, because today, as the economy and as consumers have evolved towards more of a subscription economy, we've integrated that subscription-based pricing with the idea of really unlimited access to your physician when you need it, whenever you need it, and also letting the doc and the patient determine things like how long should your visit last. There's no way an insurance company should know that. They're not in the exam room. Under our model, you get as long as you need with your doctor. You get to see him same day, next day, because we know that health issues often can't wait 3 weeks for an appointment.
You can't plan ahead. Yeah.
You can't. And the pricing is completely transparent. So we know healthcare can never be free, but you know exactly what you're going to pay. And most often that is a retainer type monthly price that right now averages between $75 and $100 a month. And anytime you need to go, you get it. Anytime you need somebody to be your advocate, you have somebody that's...
Well, think about that, especially with the HSA accounts, the savings accounts. You're throwing money into this financial vehicle, right? You could literally be providing a guaranteed connection to your doctor, and they can also rely on that type of payment coming to them, so they don't have to scurry around, right?
Yeah.
This is it's not the beginning, because these models have been around, but there's such a growth towards alternative pricing now and away from the entire insurance structure. I mean, my family is participant of this break. We actually broke away from the healthcare.gov marketplace back in November. We said enough, because we literally got so much increase in premium.
Right.
That it was not. We were already eyeballing the thing as just evil incarnate for a lot of ways, but whenever the price increase came through, we're done. So we went to different types of healthcare sharing networks, which you're very well aware of, and also looking for primary physicians that have this type of relationship with the families that come in. And you're absolutely right, about $90 a month. There's a subscription, and we have that access to the GP that, for the most part, takes care of all the wellness visits. And then there's certain things that they won't do, but even labs cost $5. Yeah. You know, I'm not quoting prices for the entire network, obviously, but literally, it's such an eye-opening experience, because you're on the outside looking in, going, "What were we doing in that fugue state that all this BS was actually foisted on us year over year over year?" And just be able to break away and be able to see that there are groups that are taking care of. It's almost like you're unplugging from the Matrix. That's what's happening.
I use that analogy.
Now, there he is.
Yeah, you're right.
And all of a sudden you see that you can actually have relationships with your doctor, and you can see them very quickly. Yeah. And all of a sudden now you're not the biggest thing. I mean, you're coming from the perspective of the physician, and the physicians that are just demoralized inside this network and disenfranchised. They went into this trying to help, and literally bureaucracy has pushed them out into retirement early. And people are actually leaving the country. Doctors are practicing outside of this country because of what's happened here. So this is the alternative, and this is the counterweight that's finally there. So I told you before.
I got him all worked up. Look at him; he's so riled up.
I told you. I mean, I had some points to bring up.
And this doesn't only just serve physicians either. This could be a huge benefit to employers. Can you touch on that as well? Because I feel like employers need to know that this is an option.
Absolutely. And employers are involved in our healthcare. It dates back to World War II, and it's become so ingrained that people expect to get their health insurance and at least their health benefits of some sort through an employer. So as employers have experienced the price shocks we all have, sometimes they've managed to avoid some of the worst of the healthcare.gov experiences, right? But they're still socked with year-over-year increases in cost, and at some point that becomes unsustainable. So what we've seen, tremendous number of employers now looking for alternative solutions, just like individuals are. And they come to us and they say, "Wow, if I could scale my insurance correctly and carve out this primary care piece, or if I'm already exposed to that risk through a self-insured type model, what would this look like to fill that gap in terms of my frontline primary care?" And so they're looking at this going, "Wow, we can actually quantify it. We can put a number on it. It's a fixed price per month or per year. And this takes care of all of that primary care that our employees use the most. And not only takes care of it so that we don't have to worry about those claims down the road, it actually reduces the downstream care that's consumed. So these practices have, like I said, a litany of benefits, right? It's more convenient for patients to get in and see their doctor whenever they need it. If they need care remotely and the doctor's on board with that, you can work through some kind of a telemedicine type visit.
Oh, that
That's
is
right.
an
Oh,
option?
yeah,
Very cool. Yeah.
absolutely.
I told
It
you
is
it's
too
updated.
cool. It is
That's
too cool.
awesome.
It's the old model that's been updated, both in terms of its pricing and its technology.
It's a
its interaction.
reboot.
It's a reboot.
Because
It is.
sometimes you can't get out of bed. And what are you supposed to do?
Yeah. Yeah.
Use your phone.
Yep.
So-
FaceTime the doc. Bang, right
Why
there.
not? Why not?
I'm sure he doesn't want to see you in that condition, but,
They'd much rather have you there than in the office, all things being equal.
That's true.
yes, coughing on their doorknobs
That's
and
true.
such. Yes.
So
You do that regularly, huh?
Not around here.
Thank you.
So the employers, though, they've begun to embrace this in really large numbers because of those benefits. It's a better benefit that they can provide for really less money to their employees.
No, it's a fantastic and very timely emergence here because families, and large families are freaking out. They just don't know where to go, and they can't afford what has happened over the last few years. They just can't. So I applaud you greatly for doing this. And there are a number of networks out there that are also faith-based networks that help in the medical sharing, and it's just fantastic to be able to see the other side of the coin and literally being unplugged from what's been foisted on us. So you're also a participant in lawmaking as well. So can you tell us about the law Freedom Healthworks helped pass in Indiana and what it means to Hoosiers in 2018?
Sure. There are some visionary legislators recognized several years ago. Actually began with some of the faith-based health sharing. Recognized that in order for those types of innovations to really proliferate and grow, you had to proactively remove barriers. And when they did that, and I want to say this was back 2011, 2012, they saw this rapid growth among the health sharing adoption in the state of Indiana. Great alternative to health insurance in a traditional sense. So this was another recognition that if we could remove barriers proactively in terms of growth of direct primary care, we would see an uptick in the growth. And Indiana became, proud to say, I think the 20th or 21st state to pass enabling legislation that really just removed any threat of insurance regulation from these physicians, these practices who employ this type of a model.
Right.
And not that was a threat in Indiana, but other states, there had been attempts by insurance regulators to step in and say, this resembles some form of insurance, so I'm going to get my hands in it. So like I said,
Sounds like them, doesn't it?
Yeah, right. So we got to participate with again, some of the legislation, the legislators that were spearheading this effort, testify, help kind of craft this legislation as it passed. And it was one of those rare bipartisan unanimous bills that passed into law. And what that means for the state is that now in the state of Indiana, direct primary care is not and will never be regulated as insurance. And that removes any doubt that a physician might have had or a patient might have had.
Right.
Am I going to run afoul of something in the future because there's still this perceived gray area out there? But that really, I would say this speaks to the level that we're involved in with Freedom Healthworks. We started out and we still focus primarily on launching, sustaining, and helping physicians prosper under this model. We also then, because it's such a relationship that is, there's a fair amount of education that has to occur with consumers to become really acclimated to the model.
Right.
We help consumers, we help individuals and families find and connect with these practices, and we help those relationships succeed as well as the employers. We've just started that in the last probably 2 quarters, working hand in hand with some employers and some folks in the insurance benefits world to bring that benefit online for employers in the state. So we're excited. We talk about Freedom Healthworks. Our mission is to fuel the rise of direct primary care, and that means not simply helping the physicians, but also the consumers and the employers.
Amen. Amen.
Is this an option for people with pre-existing conditions too? This isn't just an option for like the healthiest people in the whole world. If you have, you go to the doctor once every 5 years. What if you have pre-existing stuff?
It's a great question.
Yeah.
And the answer is this is maybe more valuable for the folks with pre-existing conditions, with chronic illnesses, than it is for the rest of us. Those of us that are healthy, and I do count myself among those fortunate few, This is a convenience thing. This is I get to go in once a year. If I ever have an issue, I'm going to be seen same day, next day. I can have a telehealth visit or something. Right? Recently traveled, got in and just I have a healthcare advocate. My healthcare advocate now says you need these immunizations before you travel to this country. Great, done and done. It's so nice to have someone in your back pocket that is that kind of medical mind. Whereas in the past, it's just hard to have that inside one of the mega networks or inside an insurance network. But the people with pre-existing conditions need the most contact with a physician. They're the ones who really need to be seen quarterly, maybe monthly. And this is one of the only models that I've seen that allows that to happen, and not simply a 10-minute flyby visit. This is something where you need to be seen, and it could last a half hour. It could be
seen
a
and
45
heard, probably, yeah.
There are stories that abound of folks who have struggled for years with what they perceived were chronic conditions, only to finally spend a full half hour with their direct primary care doctor and find out it's actually related to something totally in left field, like an allergy or something. And they've been throwing expensive medications at it for years.
And that's the other thing.
Look what you did, Adam.
Short answer, yes.
And that's it, is because the insurance industrial complex literally is self-sustaining. It will promote nothing against the doctors that are still inside the network, but my gosh, the amount of paperwork and the amount of tests that are so darn expensive, and it does get into a space where there's not an alternative, and not a way where the doctors can actually cut away and say, you know what, this is what I'm really seeing here. Oh, no. You have to have all this litany of additional factors just to eliminate this, when they can actually go and be able to find an alternate pathway to your health, as opposed to having to have so much red tape they have to go through, right?
Yeah, absolutely. We call it practicing medicine by billing code.
That's
Honestly,
it right there. Yeah.
When you're working under the insurance-based model, in order to get reimbursed, you have to constrain your medical mind into one of 30,000 billing codes and check the right boxes.
That's it.
And so it's almost a paint by number. Now, how many of us?
That's
right.
Wow.
How many of us are actually, do we adhere to a formulaic paint by number profile? None of us do. We're all individuals.
Nobody in
with
this
our
room, probably.
I paint outside the lines a lot.
So that's not on the doctors, Aaron. That is what they're forced to do
I know.
to keep the lights on, and they hate it as much as we do. They really do.
That's what I was referring to. It is such a breath of fresh air to be able to hear this. How many doctors are inside of Freedom?
So at this point, we've got 8 physicians here all around central Indiana.
Cool.
We launched our first pilot practice only in December of 2016. So
wow.
This is very early for us still. We've got Grand Design Zone, and I tell you, we are getting tremendous interest, not just in Indiana, but across the country. And at this point, we have to kind of tell folks in Texas and on the West Coast, okay, hang on, we'll get there, because what we recognized is there was no formulaic approach to this. There was no one who developed a programmatic path for these thousands of doctors who would like to migrate to this model. They'd all figured it out ad hoc.
Right.
And so we said, look, there's a better way to do this if we can refine the best practices and then make that playbook available to doctors that are interested in this model. We're going to see more of them move to this model, which only benefits all the rest of us, because consumers then have choice. And we also say this may not be for everybody. We're not saying this has to be our way or the highway. We're simply providing alternatives for consumers out there who say, I don't really like the value I'm getting in the traditional healthcare system.
It's okay.
I want something else.
Some of them want to be that gelatinous battery that's plugged into the matrix. I guess you do.
Shots fired. To connect with those 8 physicians that you mentioned, viewers and listeners can go online to freedomhealthworks.com/people/knowyourdoctor. And I think we can put that up on the screen. There we go. That works too. Just go there and then go where I told you to go.
Absolutely. And you'll be able to find that. We certainly appreciate your time, Adam, and we certainly want the employers out there to also understand that this is not just for individual decisions. Employers can absolutely explore this option for benefit, alternate types of services for their employees, right?
Absolutely. And please use the same method of contact. Get a hold of us if you're interested. If you're even if you just want some more information, perhaps it's not the right time. But the employers we've found, they've sought us out, and when we can sit down and have a conversation with them and they look at the numbers and say, wow, my employees are going to like this benefit better than what they have today.
Yep.
It's going to cost me less. And not only in terms of outlay and premium costs, but I'm going to save money on the back end, especially if I'm exposed to the claims risk, because this is better care. This keeps people out of the hospital, keeps them from the expensive surgeries and the hospitalization. So you put those together, and I think there's a reason why so many employers are reaching out, and certainly we'd love
What's
to
your
hear from
sweet
more.
spot for employers? Like who is traditionally coming to you looking for this kind of thing?
So if you're an employer, typically less than 500 employees,
Okay.
because there just aren't a lot of options for those folks.
Right.
So anybody from your two-person shop up to that call it 500-person threshold. Beyond that, not that we wouldn't enjoy talking to you, but there are more options for the larger
You'll still
employers.
talk to anyone who calls, right?
Absolutely.
Okay.
And we're finding a lot of those folks too that they employ near-site clinics or things like that. Look
Yeah.
at this and they say, "Wow, this is a better way to really provide this benefit to my staff."
Excellent. I'd love to see you back in here a year from now and talk about the success of 2018. I see nothing but growth for Freedom, and you're blazing the trails for physicians, and they need to be in your space. And as you're educating them, and as you're setting the stability of where they can go without having to be ad hoc and learning as they go. I mean, you're setting what the best standards are for how to practice in this post-insurance world, or at least a alternative to just feeding the beast, right?
Yeah, absolutely. It's time healthcare comes into the 21st
There
century,
it is.
and you look at the way it's practiced today, the way it's delivered today. That's what I hope we can, in a year, talk about how we've
got it.
affected that change.
Excellent. Well, Adam, thank you so much. We're absolutely going to, my family's going to absolutely check out Freedom Healthworks as well, because it is, we've taken the plunge, and we're looking for those primary physicians as well to make sure that we not only reach out to them, but we want to subsidize that belief system, because they're cutting edge on what should be. Yeah, I did that. Didn't I?
I got it right away.
of what is a self-writing environment here. This was what was woefully needed as a counterbalance to insurance. Well, thank you so much for your time today. Make sure you go check them out at freedomhealthworks.com, on Twitter, Freedom DPC, and on Facebook, Freedom Healthworks. Fantastic branding. If there's anything that we can do for you, you let us know, all right?
Okay. Thank you, Aaron. Brittany, I've enjoyed it.
Thanks,
More than
Adam.
welcome. More than welcome. All right.